Okay, so we're live on YouTube. Welcome everyone. It's Friday, July 3rd, and thank you for joining us for today's media briefing. Today we'll hear from Dr. Hsiu-Li Wang with an update from Public Health, as well as an update from Chair Karen Redman. We'll get started with Dr. Hsiu-Li Wang. Go ahead, Hsiu-Li.
Sorry, am I still muted?
No.
Okay, no, it's okay. Sorry. So I'm going to start with an update about farms with migrant workers and an order that Public Health has issued to them. So in follow-up to the outbreaks of COVID-19 among migrant workers in Southern Ontario, Ontario's Chief Medical Officer of Health has strongly recommended to all local medical officers of health that they issue an order to the employers of temporary foreign workers to ensure measures to prevent or reduce the spread of COVID-19 on farms are in place. Earlier this week, we issued this order to the 15 farms that we are aware of in Waterloo Region that are known to employ temporary foreign workers. It doesn't mean our farms are not already putting in place the appropriate measures. This is a proactive measure to ensure the measures will be in place. We are also mentioning it today and posting a copy of the order on our website in case there may be any other farms we may not be aware of that are also employing temporary foreign workers, to which this order would also apply. The order requires that employers must implement strict measures to ensure that all temporary foreign workers are able to successfully complete the mandatory 14 days of isolation upon arrival to Canada, as well as what to do if they develop COVID symptoms. There are also requirements for active screening and infection prevention and control measures. At this time, we have not detected any cases among temporary foreign workers in our community on such farms, but this order allows us to provide farms with clear information on the strict measures that they need to ensure are in place to prevent or reduce the spread of COVID-19. We are collaborating with the Ministry of Labor, who is currently conducting on-site assessments of the farms that employ temporary foreign workers across Ontario, including in Waterloo Region. There have been questions about whether our rates by neighborhood correlate with some social economic factors such as income, like they have seen in Toronto. We have produced static maps of some census data by neighborhood, which we have published in the past and have updated with the latest census data. These maps are on our reports page, and they relate to proportion of the population with low income, proportion who are recent immigrants, and proportion whose language at home is not English or French. Based on this initial information at this time, at the neighborhood level, we do not see a clear pattern of correlation between rates and characteristics such as income. The province will soon be rolling out instructions to health units on the collection of data on race, income, household size, and language from individuals who test positive for COVID-19 and who consent to giving us this information. Health units will be collecting this information on a go-forward basis. So we will have more information in the future about such characteristics, and we will continue to monitor for any trends. Regarding extreme heat, so an extreme heat warning, as you may be aware, was issued for Waterloo Region. It's expected that this will be a prolonged heat event continuing through until Sunday. Extreme heat can affect everyone. We can help protect ourselves from heat and humidity by knowing the weather forecast before going outside, planning ahead and modifying outdoor activities, drinking plenty of cool liquids, especially water, even before we become thirsty, and spending a few hours in a cool place or by seeking shade when outdoors. 3 cooling centers, one each in Cambridge, Kitchener, and Waterloo, will be open this weekend due to the heat warning. And for more information and tips on cooling centers and locations and hours, please visit regionofwaterloo.ca/extreme heat. In closing, we have made progress towards slowing COVID-19 in our community, but we cannot take that progress for granted. We remain at risk for a resurgence of cases if we are not careful. We all have a role to play, and I appreciate all of your efforts. The virus is still present in our community. For those of us who can wear non-medical masks or face coverings, I continue to strongly recommend that you do so in indoor public settings and on transit. Face coverings need to be used alongside physical distancing, proper hand hygiene, and self-isolating and getting tested if we develop symptoms. Together, we can continue to slow the spread of COVID-19 in our community and help it move towards stage 3 of the reopening. Thank you very much.
Thank you, Hsiu-Li. We'll now hear from Chair Redman. Go ahead, Karen.
Thanks, Julie. Good morning. I hope everyone had a great Canada Day. You know, I think as Canadians, we tend not to think of ourselves as flag wavers, but I have to tell you, I saw so many porches decorated with Canadian flags. And although we didn't gather to view public fireworks displays the way we usually do, it seems that everybody was still able to celebrate being Canadian together while staying apart. Today, I'd like to update you on the activities of the COVID-19 Economic Recovery Committee. This ad hoc committee is focused on reviewing the region's post-COVID-19 economic strategy in partnership with the cities, townships, and economic development stakeholders in order to support our community through its recovery by reviewing stimulus activities such as tax policy, reducing red tape, development charges, and capital spending. The committee will be engaging with local business community to discuss how the region and local municipalities can help support economic recovery in Waterloo region. We're looking forward for input and feedback from businesses on what they see is necessary and what their challenges are, as well as what tools and tactics we can put in place locally to help stimulate our economy. A virtual town hall meeting will be held on Thursday, July 16th, 2020 from 1 to 3 p.m. The meeting will be held via Zoom and broadcast on the region's YouTube channel. We're hoping you'll join us together on the Waterloo region's post-pandemic economic plan. At a special council meeting on Monday, July the 6th, Regional Council will be voting on 2 draft bylaws that will require mask wearing on Grand River Transit and in indoor public settings such as retail stores, restaurants, museums, and more. These bylaws ensure that considerations are made for those who are unable to wear masks or face coverings due to medical conditions or disabilities. There will be no requirement for people to prove their disability, and the bylaw also exempts children under the age of 5. If bylaws are passed, it will provide greater certainty for individuals and businesses as we continue into our recovery phases. We will share more information about the timelines and undertake an education campaign for the public. The report will be made public this afternoon, and we can answer more questions about the bylaws at that time. During the current heat wave that we're having, I recommend all of Dr. Wang's suggestions for staying cool and safe. But I'd also like to add a reminder to check in on loved ones and vulnerable neighbors, either virtually or at a distance if you're not in the same social circle. I'm sure it will be greatly appreciated. Have a great weekend and stay safe. Thank you.
Thank you, Karen. So that's it for the presentations. We'll now turn it over to you for questions, and we'll start with Joanna from the Record. Go ahead, Joanna.
Thank you. Just wondering the order that you mentioned for the migrant workers. I'm just trying to find it on the website, and where exactly is it?
So I can maybe jump in, Hsiu-Li. Oh, you're on mute. I know that it will be posted.
Sorry, go ahead.
Sorry, I know it'll be posted in our news module area on the website, Joanna, because it's a public notice.
Okay.
I'm not sure if it's up yet.
Okay.
I think it should be up very soon if it's not up yet. I want to mention it and give it some context before I posted it, but it'll be up there.
And Dr. Wang, can you just expand a bit on what you were talking about with the socioeconomic factors and things like that? And
Sure.
I didn't see any correlation. Is there a separate map for that, or is it just a map that you guys prepared and looked at yourselves?
Yeah, so it's a map that we prepared using the latest 2016 census data. And it's a static map. It's on our reports page, and it has those factors that I mentioned by neighborhood. So you'll see rates by neighborhood in the same way that you sort of see rates for COVID by neighborhood on our dashboard. So it's a color gradient to show lower or higher rates. And so you can take a look at both maps. And when you do that, you don't really see any clear correlations between rates and low income, for example, at the neighborhood level. So it's something that we did with the data that we already had. But as I mentioned, we're going to have more data because going forward, we'll be collecting data at the individual level related to race, income, size of household, and language. And so we'll, have more information with respect to those factors and be able to continue to monitor whether we see any correlations between factors like this and rates in our region. Now that testing has also been expanded to anyone who would like to have a test, this also makes it better for looking at whether there are any trends because it's no longer restricted to only certain people, the testing that is. So that's also something that will allow us to hopefully, see whether there are any correlations or not. Some other areas in the province have also looked at this, like Toronto, and they have or haven't seen correlations. It sort of depends on their data. But we know from the data that we have had to date that it was heavily influenced by the testing guidance and the fact that we had a lot of long-term care home outbreaks, and we were looking specifically for COVID-19 among those residents and staff. And so, what we have to date in terms of correlation of our rates of COVID is that they correlate highly with the outbreaks.
And if you see further correlations,
Yes.
based on race or income, is there a next step then for you guys?
Well, we would take a look at that and try to understand, where that may be coming from, and it may indicate a need to maybe deploy some different or additional resources or activities to try to, make sure that we are addressing any increased risks among certain groups. For example, in Toronto, there were some neighborhoods that had higher rates, and I know they kind of did more outreach with respect to testing in those neighborhoods. So, it's things like that that we could be looking at if we see any trends.
Okay, thank you.
Okay, thank you, Joanna. We'll move on to Irene from Air News. Go ahead, Irene.
Thank you. Dr. Wang, as you mentioned, the news release about the migrant workers will be posted, but what I'm wondering if you know offhand is that Brant County issued a Section 22 public health notice that over a week ago, and it included that migrant workers cannot work at more than one farm, and also that they have to have appropriate physical distancing in their accommodations. Do you know offhand if that's in the Waterloo Region order?
Yeah, so the order is issued by individual medical officers of health. That was the request from the chief, that we all issue our own orders, and they would be, based on what we felt was needed in our own areas. So it's also a Section 22 order, like in Brant, and we did issue the order to the farms at the beginning of this week, but we are also posting it just in case there are other farms we may not be aware of, and just to make them know that it would also apply to them. So the order lays out, fundamental infection prevention and control measures, as well as screening measures, as well as reinforcing the measures that to ensure take place with respect to quarantine for workers who come in from outside of Canada. So you'll see that probably the requirements of the orders are quite similar, but there may be some differences just based on, local medical officer of health assessments of what is most important to confirm are, most important to ensure is taking place on the farms that we have in our region. We don't currently have any cases in Waterloo Region at this time.
Okay, thank you. I guess I was focusing on not having them work on more than one farm. It seemed to me there was a relationship even in our healthcare, in our retirement homes, same type of thing. So, but I'll check the website.
Sure. No, there is no condition related to that in our order. We will continue to monitor and see if there may be additional requirements that are needed. But at this time, if someone comes new onto the farm, they will need to have had a test, and they need to put in place the required isolation measures, screening measures as appropriate for anyone that may come on the farm from somewhere else, and that may need to be tested, screened, or isolated as relevant.
Okay, that's great. Thank you.
Thanks, Irene. And I just got an update from our team that the order is posted on the public health homepage now. Okay, so we'll move on to Tim from 570. Go ahead, Tim.
Good morning.
Good morning, Tim.
With the contract tracing app, it was delayed. Are you worried this additional tool isn't going to get released? And if so, is there any way that we could do one locally?
No, thanks for the question, Tim. So I'm not really concerned. I understand, it's been delayed. They want to get it right. I think it's important that they get it right. It is an additional tool. It's not the fundamental tool that we use for case and contact management, which is still, public health nurses calling people, but I think it's going to be a helpful adjunct. And so, we are looking forward to its release, and, we will be promoting it amongst our population as well. But I'm not worried. I'd rather that they take the time to get it right, so that when we roll it out, there aren't any, unexpected bumps. So yeah, that doesn't mean that there isn't, there's still case and contact management going on. It's just this could be an additional tool that we could use for that.
Okay, and Middlesex London Health Unit used ordered masks to be mandatory. If the bylaw doesn't pass, would you use this order?
So the Middlesex London Health Unit, as you may notice, had issued an order that applied to specific settings. So the bylaw that the region will be considering on Monday, will be more expansive than what's in the Middlesex London order. So, my response will be, we'll see what the outcome is of the discussion by council on Monday, and then we'll go from there.
Okay, and last time we talked, Mike Murray mentioned how hard city staff, regional staff were working on this. How has it been to be able to get this report out to council? Has it been quite difficult this past week?
I wouldn't say it's been difficult, but it's been a lot of work, mostly on the part of legal staff, who've been working very, very hard. But there have been people that they've consulted and numerous people that have helped. And so, there's been a lot of work in a short period of time. Staff obviously want to do the best job that they can. And it will be, as Chair Redman said, it will be released later this afternoon.
Perfect. And Dr. Wang, is there any update from Forest Heights Rivera? I know the outbreak was declared over, but have you heard anything from them since then? No, they're continuing to be closely monitored by St. Mary's and public health staff, but I don't have any new updates. For the sort of maybe more specific operational updates on the home, it would be best to contact Lee Fairclough, who is the president of St. Mary's. St. Mary's is doing the oversight, day-to-day oversight of the home. Those are all my questions. Thank you.
Thanks.
Okay, thanks, Tim. We'll move on to Rosie from CTV. Go ahead, Rosie.
A question for Karen Redman. If and when the bylaw is finalized, if it is, how soon could we see masks made mandatory on public transit and indoor settings?
Can you hear me now? Okay, sorry, my speaker wasn't working. I was going to jump in on the tail end of Dr. Wong's comment. That will be up to council to decide, Rosie, and I would have to tell you that there's a real balance between doing things quickly and doing them well, and it's a very big part of education. There's a range of views about mandatory mask wearing, and we need to bring the community along with us. Clarity, I think, is really what businesses are seeking and a lot of people in the community. So I think council will have to decide how we can implement mandatory mask wearing on public transit and indoor settings in a way that empowers business to be able to participate as partners in that, as well as to educate the community. There are other examples where people have brought in either medical officer of health orders, or they've done bylaws and they've been, a very short implementation period in time. We're really keen to make sure that we can educate the community and bring them along with us. So that'll be up to council to decide, but we're going to need a little bit of time to roll it out.
And question for Dr. Wang, how would you describe where exactly we are now when it comes to the curve of this pandemic?
Oh, no, we are in a state where our rates are relatively low, and that's really good. And so far, so good in stage 2. So I would say that we really, as a community, need to keep up our public health measures. That's the most important thing. So that our rates can continue to remain relatively low, and we can continue to move forward to the next stage, a reopening.
And do you think we will be ready for the next stage? Like, what are some of examples of maybe warning signs that could be approaching a second wave? How will we know, and will we know?
Yeah, simply the cases will start rising again, and they can rise quite quickly, as we've seen elsewhere and here in our own community. So it really will be the province that will be, making the decisions about stage 3 reopening, but they will be looking at factors that they've looked at for stage 2, including what the rates are in our region. If we have significant outbreaks, what's our hospital capacity, what's our testing capacity. So far, those characteristics have been on a good trend, since we've passed our peak in April. But again, I've said this before, and I'll say it again, we are always in a precarious situation because COVID continues to circulate in our community. So we're doing very well, and that's really thanks to the community and all their efforts. It really does take a community to get us to where we are and to keep us where we are. But I would just continue to, advise the community that we always are at risk for a resurgence, and that's why we need to continue to practice those public health measures and continue to reopen slowly and cautiously as we've done so far.
Are you good, Rosie? Okay, great. So now we'll hear from Paula at CBC. Go ahead, Paula.
Hi, Paula.
Hi, can you hear me okay at this point?
Yeah,
yes.
We can hear you.
Great. So as we've mentioned, there are some other municipalities in the province that have variations of different mask policies. Were there any other places that you looked to for inspiration in developing this draft bylaw?
So a couple of things, I'm going to answer it because it is a municipal bylaw, Paula. So I don't know if Dr. Wang's going to want to wade in. We did look around the province. I mean, we've certainly considered the science, and I'd have to tell you, nobody's on the fence in the community about this. They either are soundly in favor of this and they want to protect themselves and others, and other people that feel that the science doesn't warrant it. So we looked at other jurisdictions. We looked at some communities where under the state of emergency, the head of that council or the chair of those regions could declare it as a special order. Some medical officers of health have done it. We decided that we would go the bylaw route and work with the community, work with education. I would point out again that I think we have over 2,000 bylaw interventions with only maybe 25 actual tickets being written, because we've been working with people on education and compliance. And we realize that that is going to be our best tool, providing clarity as we go forward, hopefully into phase 3, but always recognizing that COVID-19 is being spread in our community and will continue to be. And what we don't want to have happen is in any way have to revert back to a former stage because we've got to have a spike in cases. So we think that council is very much of the view, and we'll have to see how they end up supporting these draft bylaws, is that this is a step for providing clarity and partnering with business in order to make sure that we are protecting others and are taking sort of that greater community good by wearing masks. I don't know, Dr. Wang, if you want to add to that.
No, I think that was well said. Thank you.
So maybe just a little bit more specifically, it'd be fair to say that this draft bylaw is similar in some ways to what Toronto City Council is implementing?
I didn't actually study Toronto's bylaw, so I'm not, if you talk to one of our lawyers on staff or our clerk, they'd probably be able to tell you that. But
I know that our bylaw has been informed by decisions made elsewhere. So we did look at the Toronto bylaw. I can't say what the similarities and differences are though.
Okay, fair enough. And then just finally, do we know at this point what enforcement could look like and who will be responsible for that?
That again is contained in the draft bylaw, and it's at the will of council how that gets implemented. But we would very much look at the same partners in bylaw enforcement. I know for public transit, it's the code of conduct, and there is a whole regime for that, and that would be done by GRT personnel. We also have bylaw officers at the region, at the municipal level, as well as public health inspectors. So it depends what facet of the bylaw is being implemented and what council finally does with it, if it will involve all of those entities, including the police, or if they, in their wisdom, decide something different.
Okay, thank you. That's all my questions.
Okay, thank you, Paula. And with that, we've gone through the group once. Are there any other questions before we wrap up? Okay, Joanna, go ahead.
Thank you. Just another question for Dr. Wang. The other data that will be collected for individual cases, do we have a timeline on that?
We understand that the province will be rolling out training to public health staff next week. So, we're going to get instruction on data collection and data entry into the provincial database. So those are the kinds of things that we need to wait for to ensure that we can collect it on a consistent, in a consistent manner across Ontario.
So it sounds like, though, that should happen fairly soon.
Yeah, that should happen fairly soon. Yeah.
Okay, thank you.
Okay.
Thanks, Joanna. Any other questions? Okay, I'm not seeing any hands up, so I think that we can conclude today's media briefing. Thank you to everyone for joining us, and we will see you back here on Tuesday. Take care.
Stay cool.